100 metric tons of dried agent. Now, as a program
Batista
advanced,
served on Mayor Giuliani's task force on bioterrorism and wrote a book.
Bioterrorism is an emerging threat in our society, yet few know what it truly consists of. By definition, bioterrorism is the use of living organisms or their products to produce death or disease in humans. Bioterrorism has been around as early as the 1900s. The first bioterrorism attack was in Chicago in 1972. Two college students named Alan Schwander and Stephen Pera were part of a terrorist group called RISE and was planning to poison the city's water supply with typhoid.
Hi, I'm Alan Schwander.
Hi, I'm Stephen Pera.
We are a part of RISE, and we are going to poison the city's water supply with typhoid.
Stop right there!
The biggest bioterrorism attack happened in Oregon in 1984. An upcoming public figure named Osho was wanting to build a utopia on land he had purchased in Oregon. However, his building request was denied. In hopes of changing this, he intended for his followers to gain seats in the state and local governments. In order to suppress voter attendance, Osho infected salad bars in 11 restaurants, grocery stores, and doorknobs with salmonella. 751 people were infected with severe food poisoning. However, there were no fatalities. The latest bioterrorism attack known was in September and October of 2001, a couple weeks following 9/11. Letters laced with anthrax spores were sent out through the United States Post Office. They were delivered to local news medias and members of the U.S. Congress. 5 people were killed and 17 were infected.
I'm infected. Anthrax. I'm dying. Overtime.
A successful attack of bioterrorism can possibly kill 30 million people within the first year of exposure if a plan is not securely in place. However, hope is not lost. In April 2000, the CDC published Biological and Chemical Terrorism, Strategic Plan for Preparedness and Response, which addresses planning, detection and surveillance, laboratory analysis, emergency response, and communication. The CDC now maintains a pharmaceutical stockpile in several locations throughout the country. It will send supplies to bioterrorism sites upon notification by the FBI and the local public health departments. On the CDC website, there are also countless of resources available for various settings. This provides an outline for business, healthcare settings, and personal homes to know how to respond in case of an outbreak. Following the anthrax attack, President George Bush passed the Bioterrorism Act of 2002. This act was made to improve the U.S.'s ability to prevent, prepare, and respond to bioterrorist attacks. It focuses on 4 main objectives: how emergency rooms will prepare for possible attacks. This includes vaccines and medicine stockpiles. How and when to set up a registration program for people who handle toxins and biological agents, protection of food and drug supply by requiring tougher inspections, and protection of the water supply. Under the Bioterrorism Act, multiple organizations are joined together to fight a common enemy. These organizations include the Centers for Disease Control and Prevention, Food and Drug Administration, Department of Health and Human Services, and more. In order for the federal government to gain sight of the magnitude of the infection, the local health departments must be involved. Many cities have already taken initiative to provide a plan in case of an event as such takes place. City websites have sections of bioterrorism preparation. All cities have access to a public health office. An individual is able to make a report suspecting an unusual disease or outbreak at any time. The numbers of local public health offices are easily accessible through their websites. All local and county health departments are responsible for case investigation, establishing a diagnosis, notifying the CDC and California Department of Health Services, and recommending treatment and infection control measurements, and more. County responses will be conducted through the combined efforts of physicians, health department, and healthcare facilities. The government will stockpile pharmaceuticals and medical supplies that will be distributed to local departments. Local pharmaceuticals and equipment stockpiling is being arranged. A regional system of laboratories with specialized tests is currently being developed. There are a variety of methods that the government has begun to prepare in case for an attack. Although we cannot predict the time and place of a bioterrorism attack, we can plan accordingly for the repercussions that may take place to minimize the casualties. There are a variety
Combat.